The International Patient Safety Goals. Identify patients correctly. Patients are from all walks of life, right? That's why incorrectly identifying a patient can result in serious problems such as errors in medications, or perhaps sending the wrong person out to leave. These preventable situations could cause stress or even physical harm to patient. So you can see how incorrectly identifying someone can have unfortunate results, but how can we avoid this? Not only is every person different, often they'll show up with different forms of identification. So, how do we know we're dealing with the right patient? The answer is correct patient identification. The very first time a patient is admitted, they're registered using a list of approved patient identifiers. Once a person has been registered with the service, it's your responsibility to continue to check and confirm you are dealing with the right patient, before providing care, before providing treatments, and before performing or diagnosing procedures. Not acceptable to use patient room number and patient bed number, but instead ask and open questions.
What is your name?
Khulud.
Your correct name will help staff to check and confirm that they're providing treatment to the right person.
In some cases, 2 identification band will be applied in newborn babies. It might also ask for assistance from the patient's family to help obtain identify for those comatose, stroke, dementia and psychiatry patients. Correctly identifying patients ensures they receive the right treatment throughout their journey, including medication administration, and during leave approval too. Make sure you always remember correct patient identification. Improve effective communication. Ineffective communication are still a problem. These errors arise when there's misinterpretation or misunderstanding of information passed orally. These types of communication failures can lead to adverse events, including medication errors, diagnostic errors, or numeric misinterpretation. While verbal orders should be avoided except in emergencies, verbal or telephone orders, receiving and informing critical results is often unavoidable. Whenever an order is communicated orally, the recipient of the information should write the information down, or enter it into a computer, then read it back to the person on the phone, and receive confirmation that the information is correct. Without these critical steps, patient safety can be at risk. Several tools available like IPASS or SPAR to help prevent these types of communication failures, and improving effective communication. Improve the safety of high-alert medications. High-alert medications are medications that bear heightened risk of causing significant patient harm when they are used in error. LASA or look-alike sound-alike medications are medications with names that sound or look like other medication names. LASA medications are ordered with a special precaution. Highly concentrated electrolytes are medications which are based on electrolytes components and its compositions. It is labeled as high alert, stored separately and securely in the pharmacy department, and in some of the clinical units due to a clinical necessity. Ensure correct site, correct procedure, correct patient surgery. Applicability. This policy shall be applicable to operating theater, all clinical units, and other areas where investigational and/or therapeutic procedures are performed. Site marking. The arrow is the recognized symbol for marking the site. Other symbols are prohibited, especially the use of X, due to the potential confusion, which is associated with such a symbol. Sign-in is a preoperative verification process by procedure room receiving nurse, to ensure correct patient, correct site and procedure by 2 identifiers. Consent form has to be signed. Timeout, just prior to all invasive or surgical procedures by circulating nurse. All the surgical procedure team shall be present. The timeout process is applicable to all situations where the informed consent of a procedure is required. The operating surgeon shall ensure that the timeout is performed. The unit staff nurse shall document the timeout process in the surgical or procedure safety checklist of the patient medical record. The responsible surgeon or physician shall stop the process of performing the procedure if a discrepancy or a variation is found as per the timeout and assign in. The surgeon or physician may decide to reinitiate the process after the discrepancy or variation is resolved. And an OVR form has to be completed accordingly. Sign out, to be performed before the patient leaves the area, after the procedures by nursing staff. Ensure completion of correct instrument and sponge count, and correct specimen labeling. At the recovery area, the verification and checking for the presence of ID band will be carried out by recovery room nursing staff. Reduce the risk of healthcare-associated infection. Hand hygiene is essential to ensure safe and effective universal health coverage. All health professionals should follow hand hygiene guidelines, including nurses who represent first point of care, strengthening quality of healthcare systems. Hand hygiene practices are the first-line infection prevention and control, and a crucial tool to protect healthcare services. Before patient contact, clean your hands before touching them, or their surroundings. Before performing an aseptic task, clean your hand immediately. Before performing a sterile or aseptic task, like before giving your patient his or her medication, performing oral care, or inserting a catheter. During exposure to body fluids, clean your hands before donning gloves and again right after you remove them. After patient contact, always clean your hands after touching a patient. After leaving patient surroundings, clean your hands after leaving the patient care area, even if you haven't touched the patient or any object in their immediate surroundings. Maintain hand hygiene when delivering healthcare. To prevent infection transmission and promote patient safety, clean care is in our hands, and it saves lives. Reduce the risk of patient harm resulting from falls. All MAHAPIN patients shall be screened for risk of fall on admission, and reassessed at least every 24 hours, to determine ongoing need for fall prevention precaution. For chronic long-term patients who are unable to move, the fall risk reassessment shall only be done if there is a change in their condition, or if a new medication is started for them. For patients on deep sedation who are under close monitoring, there is no need for completing the fall reassessment form, as patients are monitored continuously. However, when the patient's physiological status changes, this policy shall be applied. Outpatients and emergency patients shall be assessed when the defined criteria are met. Experienced difficulties improving fall rate despite improvement efforts. Risk assessment tool, strategies and interventions can help mitigate risk and exposure related to falls, specifically to hospital settings.